My name is Chris McCracken, and I am a program coordinator for the Women's Wellness Connection program. Today, I will be reviewing WWC's patient navigation and case management program requirements. I will be covering patient navigation, case management, the loss to follow-up and refused policy, and when to terminate patient navigation and case management. Women's Wellness Connection, or WWC, separates patient navigation and case management services for reimbursement and to ensure appropriate agency staff are providing these services. Patient navigation activities are required to assist a client to complete breast or cervical screenings. Case management is required when a screening is abnormal and a client needs assistance to complete diagnostic testing and into treatment if needed. Patient navigation is an individualized intervention and intensive in nature. Therefore, priority should be given to navigate clients who otherwise would not complete the screening process. Required patient navigation activities may be provided by non-clinical professionals. Although patient navigation services vary based on individual clients' needs, at a minimum, patient navigation must include the following: written assessment and resolution of barriers to screening services, client education and support, monitoring patient progress in completing screenings, and a minimum of 2 contacts with the client between the patient navigator or case manager. WWC requires that clients who have abnormal screening results receive follow-up services up to the point of a final diagnosis. This is achieved through case management. The goal of case management is to ensure clients enrolled in the program receive timely and appropriate diagnostic and treatment services. An abnormal screening result is determined based on nationally recognized screening guidelines identified in the Clinical Services section of the WWC Provider Toolkit. Required case management activities may be provided by non-clinical professionals, but a qualified healthcare professional, a registered nurse, physician assistant, or physician in good standing to provide healthcare in Colorado must have oversight when clinical expertise is required. Although case management services vary based on an individual client's needs, at a minimum, case management must include the following: notifying the client of an abnormal result, a written assessment and resolution of barriers to diagnostic services and treatment if needed, client education and support, arranging diagnostic appointments on the client's behalf, client tracking and follow-up to monitor client progress in completing diagnostics and treatment, and a minimum of 2 contacts with the client. A WWC client contact and tracking system must be in place. Contacts with a client should be clearly documented in a client's medical record and include what type of follow-up is needed, the recommended time frame for follow-up, and the clinical implications if the follow-up does not occur. Contact with the client should continue until one of the following occurs and is documented in the medical record. Recommended follow-up evaluation has been completed and the client has been referred for treatment if indicated. 3 documented attempts in contacting the client have been made, and if the client has a valid address, one of these attempts must be in writing and sent as a certified letter, or an informed refusal is documented in the client's medical record. Depending on screening and diagnostic outcomes, patient navigation or case management services are terminated when 1. A client completes screening and has a normal result, 2. The client completes diagnostic testing and has normal results, 3. The client initiates cancer treatment or refuses treatment. When a client concludes her cancer treatment and has been released by her treating physician to return to a schedule of routine screenings and continues to meet WWC eligibility requirements, she may return to the program and receive all its services, including patient navigation or case management. Clients screened through WWC Clinical Services who are subsequently insured may continue to receive patient navigation services. In such instances, agencies are encouraged to continue navigating clients to ensure diagnostic procedures are completed and if cancer is diagnosed, that treatment is initiated. For more information on patient navigation and case management, please review the Provider Toolkit found on the website or contact the WWC team.